Good afternoon. We're here to discuss the 4 cases of novel H1N1 influenza confirmed in New Hanover County. Worldwide, WHO has reported that 13,398 cases are now in existence. The Centers for Disease Control have reported that there are 7,927 cases in the United States. North Carolina has reported that there are 18 cases in the state, and now we can join that crew by saying there are 4 cases now in New Hanover County. And let me go over the press release with you very quickly, and then I'll open it up for any questions that you may have. New Hanover County Health Department was notified at 12:45 today by the State Laboratory of Public Health that there are 4 cases of H1N1 influenza virus. They have been confirmed in elementary age school children here in New Hanover County. The parents of these children have been notified. The New Hanover County Health Department is working to determine who might be exposed before the patients showed symptoms. Officials will be notifying anyone with whom there was close contact. People who have been in close contact with patients will be advised to go home at the earliest sign of illness and to minimize their contact in the community to the extent possible. New Hanover County remains in contact with the North Carolina Division for Public Health, the local school system, and physicians. School closure is not recommended at this time. The following information can help residents prevent transmission of the novel H1N1 influenza. Most important, wash your hands frequently with soap and water or use alcohol-based hand rub. Cover your mouth and nose when coughing or sneezing. Avoid close contact with those who are sick. Stay at home if you are sick. Influenza-like symptoms include fever, cough, sore throat, body aches, headache, chills, and/or fatigue. Some people have reported diarrhea or vomiting associated with this virus. Like seasonal influenza, novel H1N1 influenza in humans can vary in severity from mild to severe. Certain groups might be more likely to develop the severe illness from this infection, such as persons with diabetes, heart disease, asthma, or emphysema. Pregnant women are also at risk for complications from this virus. People who feel sick should check with their health care provider about any special care they might need. For additional questions, residents may call the State of North Carolina Care Line at 1-800-662-7030 or go to the North Carolina Division of Public Health website, and that's www.ncpublichealth.com. Also, the Health Department has a message line at 798-6684, and it has additional information. So that is the information from the press release. At this point in time, I'll ask Dr. Ryan or Dr. Lurch if they have any comments, and then we'll open it up for questions.
Do you want to start?
No. Go ahead.
Okay. What we'll be doing, of course, is working closely with the Health Department, and we do have, given the hour that we're at, we do have the Alert Now system where we will be informing parents by telephone that this has occurred, and that will be followed up by a letter going home tomorrow.
The New Hanover County Health Department has been monitoring this novel H1N1 influenza virus since it first broke in April, since we first detected cases in the nation in April. And in fact, we've been meeting about it since late April. We have sent cases to the state lab since that time, and these are the first cases that came up positive. We will continue to monitor the situation in our county to do what we need to do to protect the citizens of our county. And we will, as Mr. Rice mentioned, we will continue to trace contacts to try to determine who has been exposed to this virus.
Were all 4 of these students in the same school?
Actually, 3 of them are at Gregory, and 1 was at Snipes.
Were the 3 at Gregory all in the same class? Or
I do not know as far as that whether that occurred or not. We just have confirmation of the cases. The students that have flu are going home, and working with the health department, we're talking about them staying home for at least 7 days. So a lot of children are sick and they go home. It's just putting it all together now.
Do we know, I mean, so they're currently, as we sit here and speak, they're currently have this now. This is not something based on a week ago or something like this.
We received the report from the state laboratory today that these 4 cases are positive.
Okay. I guess what I'm asking is when would they develop symptoms and when?
It could be as much as a week ago, because that's why we're telling people to stay home for 7 days from the onset of the symptoms, so that they won't infect others.
Symptoms.
You mentioned that there's no requirement right now for closing the school, but is there ever a possibility in the future?
If the school would be disrupted in a large way, then we would reconsider. At this point in time, recommendations from the Centers for Disease Control and from the State Division of Health recommend that school closure not occur at this time. We have 3 cases in one school and 1 in another that we're currently tracking, and should more cases exist, then we'll revisit that question in the future.
Are there any other suspected cases that have been sent to the lab in relation to people that have been in contact with these students?
Not at this time.
So there's no other pending?
No, we received all the results back. We, as Dr. Ryan said, we've had 15 suspect cases since the end of April that we have sent at different times to the state lab. These are the first 4 that have come back positive, and these are the most recent tests that we submitted.
Yes, we have none pending at this time.
Do you know how long they've been out of school? Or?
I believe since late last week. Is that correct?
Yes. It's my understanding that once the children became symptomatic and had symptoms, the parents immediately took them out of school, and they have been out of school.
Yeah. So the parents were very responsive.
Could you speak a little bit about how the decision went in terms of balancing whether or not it was worth closing?
Well, the issue, things have changed. I believe we went from the idea that schools needed to be closed to now the recommendations are that that school closure is not recommended. And what we are following are the recommendations that are coming from the health department.
And I will add to that the CDC has actually modified their recommendations, and their early recommendations were for school closure with even 1 case. The CDC in the past several weeks relaxed those recommendations and have not recommended now that schools be closed for 1 case. They say if school operations are significantly disrupted in one school, then you would consider close the school. But we're following the CDC and the state guidelines and have been in contact with the state about this.